Yes, it's our first.
Hello, I'm Rona,
I'm her husband Trey, and this is Kiwi.
and we're Alyssa's friends.
They will be my audience for my speech on complacency and the importance of multi-capability in healthcare. Good afternoon, family, friends, friend. For formality's sake, I'm going to introduce myself formally. My name is Alessandra Mariano, and I'm here to touch on the idea of complacency in medical care. There's a saying that I learned from my dad that makes so much sense from being a part of the military these past 3 years. He told me that the sharpest you'll ever be is in basic training. This isn't just about the job, this is the foundation of paying attention to detail, knowing that each event makes a difference. It's truly not that different when applied to other practices, especially in healthcare. As current and prior military and healthcare professionals, it's easy to say that we've all reached a point of knowing our careers after this long. Whether it's supporting public health or my job working behind the scenes to produce things, it's important to remember the process, the standards and expectations, and that complacency starts when these are neglected. It isn't a lack of knowledge, but rather because we are already experienced. We become so comfortable with our daily tasks and responsibilities that we start relying on habits and acting on autopilot. Shortcuts, assumptions, and missed details are a byproduct of doing things out of habits. In healthcare, small oversights have significant consequences. Think of it as the very first question you get asked when you're at a medical appointment. What is your full name and date of birth? While this is done out of formality for most, it's often a verification process that ensures that we have the right patients being seen for the right reasons. Missing and incorrect information, incomplete assessments, and breakdowns in communication are all a part of a chain that can affect the patient. They are a leading cause of patient safety incidents in a medical facility. In fact, a 2025 systemic review for the Annals of Internal Medicine found that poor communication is contributed to nearly a quarter of those studied incidents. This shows that technical expertise isn't the sole thing that's causing mistakes. It's also important to maintain awareness, effective communication, and attention to detail. Complacency's worst case scenario is often a result of sensible events. These are sudden and unexpected harm and even death that affects patients. It's a major concern in healthcare, which, according to the Joint Commission's 2025 Sentinel Event Annual Review, it has caused more than 1,500 events reported nationwide in the previous reporting year. These are common causes that include failure in communication, safety processes, and human performance. I believe that this is one of the biggest lessons we can keep in mind. Most people don't come to work with the intention of making mistakes. It happens when we rely on familiarity to carry on to the day. It takes presence, active commitment, and critical evaluation to understand these situations. By further developing ourselves and our professions, we can go against the urge to be complacent. Think about the recent flu outbreak at Lapland this year, or it was even over a month ago. Many news sources, including Fox San Antonio, cited 275 basic military trainees being affected with at least four situations requiring hospital care. This emphasizes how the military carries on with the mission and needing to combat complacency by understanding where it needs to fill for manning. This is important for understanding that technical expertise, attention to processes, and understanding that individuals that are most effective are not exactly the ones that are most specialized in their field. They're the ones that can fill the needs of the mission, being able to adapt to requirements, and willingly contribute with any support that they can. Being prepared for these types of happenings creates the framework for being multi-capable workers. We develop our knowledge outside of primary responsibilities and create more resilient organizations when the periods demand it. From the 2025 American Hospital Association's Healthcare Workforce Scan, it highlights that it's important to maintain training, upskilling, and workforce flexibility. They are essential tools that can be used for meeting operational demands and maintain the effectiveness of the organization. As a lab technician, I'm not exactly the most experienced working directly with patients, but it doesn't limit my ability to reinforce processes and procedures for patient safety and patient care. We contribute to the mission by training our technicians and providers on standards and practices that effectively run safe working environments. Spreading awareness is a means to ultimately protect both personnel and our patients. Considering other departments, public health professionals apply developing good habits by preventing means to spread disease, and medical processing for trainees considers how they have to keep track of patients that need certain vaccinations. Important processes are in place to ensure that patient care is met with quality and discipline. Effective practice is driven by consistency. A 2025 patient study found that healthcare organizations strengthened their safety culture by measurable improvements in reporting and transparency. This is facilitated through leadership engaging with their teams, continued education, and reinforced accountability. This maintains good habits that create a culture that keeps people present in the processes each day. It's easy for us to believe that we're already proficient, but it's already a challenge to go beyond what we know. Never stop learning, never stop improving, never stop looking for ways to be more capable in the moment. The moment this mindset settles in, they go past complacency, with the skill to excelling with competence. In closing, complacency can be misinterpreted as confidence. It becomes a dependable shortcut that risks bad habits of not cross-verifying information, the process, or continuing to learn despite repetition. It is an inevitable process in progression, but it can be countered with an improved mindset. Striving for improvement, consistency, and willingness to go beyond expectations helps us challenge complacency. Each department has practices and responsibilities that contribute to the same mission, which is treating our patients. By remaining capable, adaptable, and committed to our standards, we can strengthen our readiness, ability to protect people, and to improve the outcomes of those that depend on us for care. That's it.
Yeah.
Do you have any questions?
You?
Can you give us another example of being complacent at work?
Being complacent at work can be seen as, I guess, not contributing, like when someone that you're working with is doing something else.
Mhm.
So you can avoid being complacent by learning a new skill that you're not familiar with, or like learning a new task. That way you can help someone that's already busy working.